There's a lot of different causes for migraine headaches, right? You have a lot of, the Imitrex medications, NSAIDs, different things over the counter to get to the pain, treat the pain. And that may be okay in an acute situation, but what's the root cause? You really want to think about what's driving the underlying root cause of your headaches, of your migraine headaches, so to speak. Now, been in clinical practice well over a decade, seen 5,000 plus patients, and migraines aren't that difficult to fix. There's a couple of core root cause issues that if you get to the bottom of them, you can have major, major improvements. So one of the first things that I see is dysglycemia, making your blood sugar go up and down like this throughout the day due to one, not eating enough protein and fat, eating too much carbohydrates, or just skipping meals altogether. That can cause this dysglycemia, that just imbalances in blood sugar. The more your blood sugar surges up and down throughout the day, you have different hormones that get released. So on the way up, when your blood sugar is surging, you're making a lot of insulin from your pancreas to bring that blood sugar back down. And when your blood sugar crashes back down, you're actually making cortisol and adrenaline to actually bring it back up. And so you're constantly surging your adrenals and pancreas all day long, and that can create inflammatory issues. Number two, just the inflammation in your food. The more inflamed you are, right? Think of your stress bucket as your ability to handle inflammation. The more you're putting inflammation in through your foods, that's going to be a big problem. So one of the big inflammatory foods is gluten. Gluten is going to do different things on the inflammatory side. It can take these carotid arteries here, right? These are the garden hoses up the side of your neck, and it can actually constrict them down, and that can decrease blood flow to the frontal cortex. There was one study where they cut out gluten in patients, and they noticed 90%, 9 out of 10 had a significant improvement in their migraines. Now, it's not just gluten. You got to cut out all grains to begin with. Most people, when they go gluten-free, they still eat a bunch of rice, a bunch of corn, a bunch of oats, and that can sometimes cause cross-reactivity, and your body still sees it because there's a resemblance between your brother and your cousin and your sister. Even though it's not you, there's still going to be a genetic resemblance, and your immune system can see that. So inflammation in food. So gluten and grains are just one of those. You could also look at things like dyes and coloring. Salicylates a lot of times can kind of be in that camp. Salicylates can be even in healthy foods. So I don't recommend cutting everything out. I recommend looking at the individual, seeing where I think their big stressors are. And I just start with the core foundational things and work our way up. So blood sugar is one. The inflammatory foods like the gluten. We could also add in junky vegetable oil fats, canola oil, safflower oil, soy oil. These are all going to be major issues in causing inflammation. Excess omega-6 fatty acids are going to increase your prostaglandin 2, and that can drive more inflammation. Gluten, processed sugar, flours. I also see too, when I chart a female's full month-long cycle, a lot of times we'll see migraines come in at certain times of the month. It could either be something that's premenstrual, so right before you're about ready to menstruate, you could see it then. You could see it around ovulation. A lot of times, if I run a month-long cycle on a female patient, we'll see these significant drops in estrogen can actually drive a migraine headache. So we can use different herbs to kind of curtail and help with the signaling upstream in the pituitary, the FSH and the LH. That can help kind of curb out the signaling, so we have those better flow throughout the month, not these big ebbs and flows. We can even use DHEA at certain times to kind of actually help balance out that estrogen. We could use like things like like maca or feminescence. I use that a lot to kind of help modulate the estrogen receptor site. That can be helpful.